Hi, everyone. Welcome to the Society of Thoracic Surgeons General Thoracic Surgery Database monthly webinar. Today is Friday, July the 16th, 2021. Again, I hope you all are having a good summer. I know for one, I am enjoying the warmer weather. I am not a cold weather person, so I am absolutely digging these hot temps and sunny days. So, all righty, let's go ahead and get started for our agenda today. We'll just have a quick STS update. We'll turn things over to Iqvia for a brief update, and then we will just open up the floor for you all. If you have any questions or anything that needs to be addressed, we'll just turn things over to you all for your feedback. Again, welcome, and if you have questions, please do submit those to via the Q&A function. We also have the raised hand function enabled, so if you would rather just speak instead of typing in your questions, or if you need to clarify anything, again, just please use that raise hand function and we'll get you unmuted so you can talk. Just be sure to enable your microphone so we can hear you. So again, you can submit your question via the Q&A or you can use the raise hand function. On the call with me today, let's see who we have. We have from STS, we have myself, we have Carol Crone, Addie Dolan, we have Sydney Clinton joining us as well. From the core group side, we have Ruth and we have Katie. And then from the Iqvia side, we have Jean, Joe, and Michelle. Melanie is on vacation this week, so she is not joining, but she'll be back for our next webinar. So Joe will be handling things for Melanie today. All right, so let's go ahead and get started, jump in. For our STS updates, everyone is aware the spring and fall 2020 harvest analyses were published and released on the spring 2020 was released on June 1st, and then the fall 2020 harvest analysis were available shortly after that on June 14th. The spring 2021 harvest is set to close a week from today on Friday, July 23rd. And then the opt-out date for that spring, for this current spring harvest, is Tuesday, July 27th. So you have until Tuesday, July 27th. If you do choose to opt out of the harvest and not have your data included, just a reminder, if you do choose to opt out, that means you will not get a report for that period. You will not have star ratings. You will not have benchmark data. So again, if you do choose to opt out of a certain harvest, just know that that means your data will not be included in the analysis and you will not have a star rating, a composite, or access to the STS benchmarks for that reporting period. The fall 2021 harvest is scheduled to close shortly after we close the spring harvest. It's scheduled to close on August the 27th. And again, the opt-out date for the fall 2021 harvest is scheduled for Tuesday, August the 31st. We are just we are trying to get back onto our regular spring and fall harvest schedule. So thankfully, for the continuous harvest, you guys have been able to, or should have been able to continue to submit your data over this last year. So again, the spring is scheduled to close Friday, July 23rd, and then the fall harvest is scheduled to close shortly after, about a month afterwards, scheduled for August 27th. If you have questions about the harvest schedules, there is a link here. STS harvest schedules and information are posted out on the STS website for all databases. So please be sure and check the STS website for harvest schedule related information. Next, for our data version 5.21 update, as everyone is aware, data version 5.21.1 went live as of July 1. So surgery dates as of July 1, 2021 forward must be entered in data version 5.21. Do not enter surgery dates of July 1 forward in the 241 data version. They will not be accepted into the database. Again, surgery dates July 1 must be entered under data version 5.21. In regards to 5.21, we did hold a series of upgrade webinars. We held those earlier this year, and all of those webinars were recorded and posted out on the STS website. So there is a link here out to the STS webinars page so you can access those recordings and go back and listen to those. Carol did walk through the new data collection form variable by variable and gave an explanation and gave a review on all the new changes for the new data version. So All of those webinars are available out on the STS website if you would like to review those. The 5.21 data collection form was posted out on the STS website along with additional resource information. We have the data specifications posted, software specifications. There's an itemized change document from 241 to 5.21, and there's also a change summary document posted out on the data collection resource page. In regards to, I just wanted to touch on one question that we've gotten recently. In regards to the 5.21 data collection form, there is only one data collection form for 5.21. I know in the past we had we had two data collection forms. We had a form for the non-analyzed cases or the minor procedures. We are no longer having those two separate forms. The STS would like to collect all, complete data for any of the data that's coming into the warehouse. So there is only one data collection form for 5.21. And I think we have some questions coming in and we can address those. I don't know if, Sarah, did you have anything you wanted to add in regards to that one data collection form for 5.21?
No,
if you had
just
anything
important.
Okay.
Yeah, that we have complete data on the cases that are coming in, and you don't need to. Leanne?
Oh, yes.
Sorry, I just wanted to say that we, STS wants complete data on all cases that are coming in. So fill it out appropriately for the surgeries that you're abstracting.
Thank you. The training manual is coming very soon. We're in the last stages of the training manual. Thank you guys for being patient as we work to get this completed. It's been a huge undertaking. We have a few remaining questions that we need clarification on from the surgeons. So as soon as we get that information from the surgeons, we will be posting the training manual. Our goal is to have that posted next week. So again, that is coming very soon, and we do realize that is very important information, and you need it as quickly as possible, and we are working to get that out to you as quickly as possible. If you have any questions about a data element for the new version, again, just please submit an FAQ. There's a link there to the clinical questions, to the clinical question form. So just be sure and select the appropriate data version for your question and get that FAQ submitted. And Ruth will address those FAQs, and the core group will discuss those, and we'll get those responses to you. If you have any questions about vendor certification, if you have not yet received your 5.21 software, a majority of the vendors have been certified. If you have not, your vendor has not pushed out the software to you yet, you would need to reach out to them directly regarding what that timeline looks like. Until you get your software uploaded into your network, you'll have to, collect on paper. But again, if you have any questions about when that software is going to be released to you, if you do not have it yet, please do reach out to your vendor directly for information on the status. AQO is coming up again. It's virtual this year. AQO will be held October 12th through the 15th. The general thoracic session is going to be on Wednesday. Again, free registration for all data managers. You need to confirm your contact information and ensure that you are listed as a data manager for your site. Please email us at stsdb@sts.org if you're not sure if you're listed. If you need to get added as a data manager for your site, the participant contact form must be submitted by the primary data and file contact for your site. I have included a link here to the participant contact form, as well as a link to the database participant and platform roles. If you have questions about which roles you should assign. Again, all that information is out on the STS website. And again, if you need to confirm your contacts for your site, please email us at stsdb@sts.org, and we can get that information for you. Also, in regards to AQO, we'll have our What Data Managers Want to Know session. If you have any specific questions that you would like to have addressed by our panel, please email me your questions to ljones@sts.org by September the 15th, so we can share those questions with our panel. The panel will consist of surgeon leaders, STS staff, core group members. So again, If you have specific questions that you would like to be addressed by our surgeon leaders or STS core group members, please submit those questions to me by September 15th, so I can get those questions shared with our AQO panel, so we can get to discussing and reviewing all those questions. Let's see. Also, just a quick friendly reminder in regards to the STS cardiothoracic surgery ebook. You do have to subscribe. There is a fee for the STS cardiothoracic surgery ebook. If you'd like to learn more about the ebook, please reach out to us at sts.org/ebook. That's all that I have so far for STS updates. Next, I'm just going to turn things over to Joe from Iqvia for a brief update.
Great, thank you. Good afternoon, everybody. Just a few items for me today. Some known issues that are currently being worked on, and we're hoping to get into a upcoming release. STS 6270. The date of last follow-up and mortality status at last follow-up variables are showing up on the missing variable report for cases where the demographics form version is 2.2 or prior, which is before those variables were added to the data collection tool. So we are looking to make updates so those don't get flagged against you on the MVR for those cases where that demographics form is before. STS 6782 on the risk adjusted dashboard report, the results displayed when you hover your mouse over the bar and the bar charts aren't matching up with the results in the actual data table. And so we are looking into that, and we'll have that corrected as soon as possible. And then on the harvest summary report, STS 6750, when using the harvest summary report, it seems that when you click on the pie slice for warnings, it's showing the cases that only have warnings. Cases that have both errors and warnings aren't showing up. So we are looking to get that fixed. As a workaround for the time being, if you click and drag with your mouse to select the warnings column, that should work for you. It should show all the correct warnings cases. But we will get that fixed as soon as we can, so that you don't have to continue to use that workaround. But that is everything for me today. Our usual reminders that if you have submitted a ticket and you want an update, feel free to reach out. Otherwise, if we didn't mention something that you have reported, please rest assured that it is being looked into and worked on, and we will provide updates as they become available.
Thank you, Joe. I appreciate it. All right. For STS Iqvia support plan, you all are very familiar with these. With this slide, again, just when contacting STS or and Iqvia, please be sure to include your 5-digit participant ID, phone number for Iqvia support, as well as the email for tech support is located here. Here's a list of resources that are available to you out on the STS website. Again, if you have any questions or need anything, please feel free to contact me directly. My direct email is here, ljones@sts.org. Here's my direct line. Feel free to call me as well. For any database operational questions, please reach out to us at stsdb@sts.org. Again, if you have questions regarding your contacts, your participation agreement, contracts, fees, those types of questions, again, please reach out to us at stsdb@sts.org. If you're not sure what exactly you need to email, please feel free to email me directly, and then I can get you in touch with the appropriate staff. All right, go ahead and mark your calendars for our upcoming webinars. Our next our next user group call is scheduled for July 28th at 2:30 p.m. Central. And our next monthly webinar is scheduled for August 11th at 2:30 p.m. Central. So again, just mark your calendars accordingly. As also, STS Marketing will also send out reminders regarding those two webinars. So again, July 28th and August 11th for our next upcoming webinars. That is all that I have in regards for STS updates and Iqvia updates. I do know we have some questions coming in. So I wanted to go ahead and get started with our questions. All right, let's go ahead and tackle some of these questions that are coming in. Our first question from Maggie. In the last call, it was mentioned that surgeon worksheets would be part of the 561 upgrade. I don't see them under the data collection resources. Is this something STS is providing? And if so, when will they be available? So yes, Maggie, we are going to get some surgeon worksheets for the database. I am working on those along with Ruth and so we will be working to get some surgeon worksheets out there, but they are not yet available. If you have some ideas on what you would like to see in a surgeon worksheet that would be helpful for you, please feel free to share that with me. You can email me directly, but again, we are working on those and we'll get those out. I don't have a specific time yet, but that is something that is going to be coming shortly after the training manual. So they will be coming, I promise. Our next question is the fall harvest close date firm. It is coming very close when we go with the spring harvest close. So it is not well, it is set in stone. It's not set in stone. We can always, see how things are going. If there's issues that arise, we can be somewhat flexible with that if we need to. But we're really focusing on getting back. We need to get back on our regular harvest schedule so we can get back in the groove of things. So with the continuous harvest, you do have the ability to continue to submit data shortly, even after the spring, the spring close. You can submit data the day after that spring harvest closes. But again, we'll see how things continue to go. If we have issues, we can definitely discuss that and see how things are once we close the spring harvest. So we can discuss that later if need be.
Yeah, Leanne, can I add on to that? This is Carol.
Sure.
So there's a couple questions in here about the timing of the harvest and why are they so close? And I just want to, if I could share my screen real quick, I can kind of walk through this with folks. Okay. Let's see here. So typically the spring harvest, which contains data through December 31st, closes at the end of February. We did not close it this year because of the transition to Iqvia. So, and we wanted you all to have your general thoracic reports out, gave you time to review those before we set the spring harvest close date. So typically, we're about, 5 months behind our normal close date for spring harvest. So that's why it's set now in July. The fall harvest, to get back on schedule, as what we've always been intending to do, the fall harvest is at the end of August, which is normal. We usually give 6 to 8 weeks after the last OR date in that harvest to set the close. So I believe we're at right around 7 or 8 weeks here for the fall harvest to be closing. You can expect the spring harvest to close again probably back in February of 2022. So there's a question here, how is the fall harvest 2021 harvest when we're still in 2021? So the fall harvest contains data through 6/30, OR dates through 6/30/2021. So we're actually, I think you have that switched with the definition of what's in spring and fall harvest. Not you, but the questions that were in here I'm seeing come through. So I hope that that's helpful for folks. And then I also wanted to show, maybe we can, when we get through some of these questions, we can give a little demonstration of where things are at on the form, like where the participant contact form is at and other resources. And I'll be happy to give a demo through the website if you'd like, Leanne, when you get through some of these questions.
Sure, that'd be great. Thank you.
Okay.
All right. I appreciate it. Okay, our next question from Karen. It has been difficult extracting since the 5.21 upgrade without a manual. Many of the sequence numbers do not match up with the old manual when the new manual be posted. So you should not be, right. We hear you. We're working to get this training manual finalized. Again, we just have a few questions that need to be addressed by the surgeons. So we are waiting to hear get their responses back. As soon as we get those responses back, I'll be doing my final cleanup on the training manual, and my goal is to have that posted next week. And I know Carol, Katie, Melissa, Ruth, everyone has been working very hard on this training manual. They put a lot of time into it. So we're making sure that it is right and you have the appropriate information. So we're making sure that we don't have any empty definitions or everything has a definition, trying to make things as clear as possible. So that training manual, again, we want to get that posted as quickly as possible. And my goal is to have that posted next week. So we realize it's not, you guys need that information to collect the data, so we are working to get that out to you. Okay, which surgeries are required to have a one-year mortality status completed? Only the hiatal hernia surgeries have a field for this information, and they are the only surgeries that show as missing a 365-day mortality status on the MVR. So let's see. Oh, Carol, you're still sharing your screen. I don't know if you wanted to pull up the data collection form or anything, but right, those one-year mortality statuses for the hiatal hernias. The task force did take away the 5-year follow-up for version 5.21. So we do not have that long 5-year follow-up any longer for 541 or 541. Is that where we're at? I'm so confused. For 5.21.
We're in 5.21. Yeah. Take a deep breath, Leanne. Take a deep breath. Yeah.
241, 5.21. Oh my gosh, I've been off all week, guys, so I do apologize. I'm kind of all over the place.
Where do you want me to go?
1-year follow-up, yeah, the hiatal hernia, the 1-year follow-up, and keep going. Yeah. So the hernia section, has the 30-day follow-up, and the 1-year follow-up is for the hernia section. The again, for the primary, lung cancer and esophageal cancer, we're no longer doing the 5-year follow-up. Under the post-op events, we do have, I'm not under post-op events, but for the discharge section, we have the 30-day status. But we are not, but we do not have that additional follow-up for the primary lung and esophageal cancers. To answer your question, Maggie, that 1 year is for that hiatal for the 30-day, and the 1 year is for that hiatal hernia section. Is the slide deck available? Yes, the slide deck will be available. I'll get it over to marketing. They'll have it posted by Monday or Tuesday of next week. They usually have this, all the webinar recording and the slide deck posted. What about the 90-day follow-up for thymus, mediastinal, and tracheal? So we'll have to go to that section. For the thymus.
Right? Oh, sorry.
No, you're fine.
These here, right? And thymus?
Yeah. So patient alive at 30-day post-op. So we have the patient alive at 30-day post-op. Yes, no.
Yep, and then if alive at 30 days, then the next 2 questions, and then if they are alive at 30 days, were they alive at 90 days? And if yes, then the 2 next questions.
Right. And again, Carol did a phenomenal job earlier on, when we did the walkthrough of this 5.21 form. So I really do encourage you guys to go back and review those webinars. If you have any questions until this, prior to next week before that training manual comes out. But again, those webinars are out on the STS website for review. And like I said, Carol did a phenomenal job walking through the data collection form and touching on each variable. Let's see, Jane, what surgery dates to submit for fall 2021? So for the fall 2021 harvest contains surgery dates up through 6/30/2020. So again, there's the harvest schedule information. And the fall harvest, again, will cover surgery dates up through 6/30/2021. All right. Are we still collecting COVID status? And if so, where is it entered? So yes, we are still collecting COVID data. It's on the 521 data collection form. It's up in the beginning. I think it's under demographics section.
I think it's the same spot it was living in before,
yeah.
right?
Yep, it's in the same spot. Yep.
Did it make it on the form yet?
It should have been. Yes, it's
I
there.
don't see it.
It's up. Yep, it's up there. Keep scrolling up. Yep. Keep going.
Slowly. Oh, there they are.
Yep.
Sorry.
Yeah. The pre-op.
Yep.
Did the patient have it? Yep. So it's right into the pre-op evaluation.
Okay.
Okay. Okay, my vendor is Cedar-On. They have not added the COVID data to the new 5.3 version yet.
The temporary
So
code
they
should be, the
Yeah.
temporary code should be there. So the temporary codes are built in every version. They just might not be labeled this way. So you may want to reach out to Cedar-On to see if they're going to add the labels in that's on the DCF.
Right. All right, so here's a question. You reminded us that there's going to be only one data collection form for 521. STS wants to enter as much data as possible for surgeries. Will minor procedures require all of the inputs that were left out before, OR time, staging, post-op events, etc.? So, yes. So the OR times should be answered. The required fields should be answered. There's data surgery, OR entry, exit. That information should be answered for those procedures.
In the non-analyzed cases, though, and correct me, Ruth and Katie, if I'm wrong on this, but the non-analyzed cases, you do not answer these 5 questions on. Is that correct? Which means the corresponding sections would not open.
Correct.
Okay.
Right.
So you fill everything out. You would answer for those non-analyzed cases. You would answer no to these 5 questions. F, G, H, I, and J will not open. You do not have to answer these questions. And then you have to still complete the post-operative events section and the mortality discharge mortality section.
Right.
Okay.
And the quality measures, there are no quality measures for this form.
If there were any that we kept, we put them in the correct spots. We didn't, right? Did we keep any?
I'm sorry, what was that, Carol?
Nothing. I was talking to
Okay,
myself.
I'm sorry. Oh no, my earbuds were going in and out, so I was just making sure I hadn't missed anything. All right, Karen, I was surprised when I received an error message in the 521 upgrade after I entered just the primary procedure on a patient in order to run a patient listing report. These error messages appear to prevent me from saving data in any chart that is not complete. Is there a workaround for this so that while abstracting, I have to move away from the chart? I will not lose this information. Karen, are you direct data entry?
Yeah, let's
I'm
go
not
to the
sure.
next
It
question.
sounds like, yeah. Yep. Let's see. Sorry to be services. Just to be clear, only the hiatal hernia surgeries are required to have a 1-year mortality status follow-up. A 1-year mortality status. We do not need to follow up any other surgery type and enter a date for last follow-up that is greater than 1 year. So in summary, everyone needs a 30-day follow-up. Thymectomy needs 30, and only hiatal hernia require a 1-year mortality status follow-up. Okay. Carol's scrolling through the form. Yep.
Yeah, that's right.
Yep.
That's
Yeah,
correct.
that's right. Yep. Okay. Can you scroll down to the discharge, right past the post-op event? Thank you. Okay, so you have to do your hospital data discharge, your status at hospital discharge, and then if discharged alive, last status alive, or discharged alive, data after discharge, you'll fill out those variables, and then status at 30 days after surgery. So there's no 1 year. It's just status at 30 days after surgery. So yes, Maggie, you are correct.
I
Okay.
see you have a hand raised. Nancy Say Too has her hand
Oh.
raised for you, Leanne.
Oh, okay. Thank you. I don't have my, hold on, my participant box went away. Let me
got-
go. All
I
right.
unmuted.
Okay. Hi, Nancy.
Oops.
There you go.
There you go, Nancy.
Oh, okay. How are you? Thank you. Question, which I think someone sort of answered in the chat. There's a new box in the Iqvia that you're supposed to click if you want to choose a chart record or something. I guess I missed that. Is that new when you upload?
Yeah, this is Joe. So when you upload at the very top of the screen, there is a drop-down menu where you need to choose case form prior to submitting your file. That is something we're working with our developers to get defaulted for you in a future update so that you don't have to do that every time. But for the time being, yeah, you do need to make that selection at the top of the page.
Okay, thank you.
Yep.
Thanks, Nancy. Thanks, Joe. Okay. Oh, so Karen had followed up. So Karen, I would have to reach out to your vendor because I'm not seeing the vendor software, so I'm not sure how it works in its functionality. So that would be a question that you would need to address with your software vendor with CardioPulse. Okay. Let's see. Carol, while we're waiting to see if anyone has any additional questions, did you want to do your tour of the website?
Let me
just to point out.
Yeah, let me do my tour of the website.
It's your tour because our one of the questions we get all the time, how do we add someone? How do we add a surgeon? What forms do we need to fill out to add the surgeon or add a new contact? So obviously you need the participant contact form, and if you're adding a surgeon, you need to schedule A. And then Carol can do her little tour and show you where all of that information is located out on the website. Carol's a great tour guide. She's phenomenal.
Yeah. All right. So this is, thanks, Leanne. So this is sts.org. When you type in, this is the homepage that you'll get to. The online learning, different information here. This is where you'll find the cardiothoracic surgery ebook, if that's something you're interested in purchasing, or if your department would purchase that for you. Meetings. There's a couple places to get to the AQO meeting. One is listed under meetings live courses. If you click on that, you'll see the 2021 Advances in Quality and Outcomes, which is our AQO meeting, a data managers meeting. Registration is supposed to be announced in the coming week. So by the end of next week, I believe. So check this page out for more information on AQO, and you could add a calendar reminder to your Outlook calendars or Google calendars here if that's something you'd like to do so you don't double book yourself. And then quality and safeties, this is the performance measures. So you'll find it starts off with adult cardiac and all of our NQF endorsed measures, congenital, and then general thoracic. Clicking on these are the NQF endorsed measures. Clicking on these, you'll find the inclusion exclusion criteria, what makes up the numerator, denominator, and other parts, things like that. So again, that was under, let me see if I can get back there easily instead of scrolling through the whole thing. That was under quality and safety, performance measures. And then we have different things here, patient safety and surgical checklists that you can share with your care team. Registries, this is where you'll find the 4 STS national databases: adult cardiac, general thoracic, congenital, Intermax, PDMax. You'll find the link to the public reporting and then the STS ACC TVT registry. Under the STS national database, this will be where you'll want to visit the most. I just clicked on that. Oops. Hold on. I just clicked on that and it took me to the home page. There's quick link buttons up here that will take you to each of the registries, the STS database registries. Information on joining the registry. You'll find the list of approved vendors underneath this link. These are our fees. So if you're working on budgets for your hospital and they ask you the cost of the registry, or you're trying to figure things out there, that's where you'll find the most information. And then under this, how to participate, information on joining and your contract. And then this is where you'll find the vendors compliant software. These are all of our software vendors, and you'll find out, I'm just going to click on ARMIS because they're listed alphabetically, which versions the vendors have been certified for. So General Thoracic, ARMIS has been certified for version 5.21, and I know that they're already getting their software out to their sites. So all that information is listed per vendor. And then if we go back, I just clicked on this link over here. You'll find the links to the webinars. Under the webinars, you'll find, we'll scroll down to you'll find the next two that are upcoming. So this is today, and then the next user group is on July 28th. And then the past webinars are listed here. It's, we're going to clean this up and remove some of them. So I suggest if you wanted to pull down the PDF slides to go ahead and do that, because when we move them, they go to the YouTube channel and they're all listed here, just without the slides. So that's that. And then what else do we have on this page? We'll have more information on the composite measure series once that's available. Clinical request form, this is where you submit your FAQs and hope to get a response back within 30 days. Our goal is 30 days. Sometimes it might take a little longer depending on the nature of the question and if the surgeons have to discuss it amongst themselves before they provide us with a consensus. And then important resources is probably the place you'll visit the most outside of the specific database resources. So the Go Live checklist, if you're new to the database, this is a good place to check out. All of these are good to check out and just get a better understanding of what's there. Data manager education, you'll find the link to the webinar. And then we have a couple other things posted here: dashboard overview, uploader instructions, our yearly data manager results, which we did earlier this year in January. These are all the questions that we asked you on one of those, on one of our webinars back in January that you provided responses to. So those are posted here. And again, this is registries, just the national database, and then data manager education. I'm going to go back here. And then harvest schedule and information, that's where I found the harvest schedule. And I'll tell you how to read this. So this is the spring harvest. This is the harvest we're in now. The harvest window submission, it's continuous, so you can upload data at any time. There's no, previously we used to have 2-week submission windows. We've gotten away from that the last, I want to say 5 years or so, where we've gone to continuous submission. So you can submit anytime you want. The harvest window is going to end on July 23rd. It will contain OR dates through December 31st. And we expect the report to be posted the end of the summer. And it is a star rating report. The fall is again continuous, so you don't have to stop submitting cases if you already have data from post December 31st. So these are cases from January 1st through June 30th. Keep on submitting those cases, cleaning your data. Harvest window is going to close on August 27th, and it'll contain data through June 30th, 2021. We expect the reports to be posted in the winter time, probably early winter, I think, because it's August close date. So usually about 6 to 8 weeks for a report to come back and get QC'd at Iqvia after it comes back from DCRI, and that too will be a star rating report. And then let's go back to this. Database forms this is going to be your part where you find your participant contact form. So if you need to update your contacts that are abstracting data, your data quality recipients, and any other roles under other resources here, This is your database participant role description, and you'll find out which, we start with Intermax. Adult cardiac, general thoracic, and congenital all have the same roles assigned for access to the Iqvia platform. So this will explain the type of access that each role will have. So you'll need this when you're going to fill out your participant contact form, which is an online form. It requires your information, it requires your PID, and then which database. When you go into the next page, it'll get more information from you about if you're adding or removing somebody. And I think you can just fill out one form for multiple people. That form gets sent over to Addie Dolan, who's on the call with us. And Addie has a quick turnaround time for getting folks added and things like that. Once, if you're adding a new person, it can take probably up to 72 hours, 3 business days to get your Iqvia login information sent. So even though you fill it out right away, it doesn't happen instantaneously. There's some manual entry that has to happen on our side. And then your Iqvia login information is sent over. Schedule A is for if you're adding a surgeon. Schedule B is the anesthesiologist part that doesn't apply to general thoracic. And then the surgeon specific form, this is for adult cardiac, surgeon specific online election form. So that's probably the most important spot you'll want to go. So again, that's registries, STS national database, and then just scroll down and it's under database forms. And there's a couple other resources here like STS National Database News, which is our newsletter that gets sent out 6 times a year. The next one due out is July, August, and our marketing team is working on that now to get that sent. You can find current issues and past issues here. Really just updates, things that are announced on the webinars, but might find other helpful information in here as well. And these are all of our publications on the left-hand side. Okay, and then what else do we have? Contact.
Let's see. Yep.
Contact information. This is the Iqvia. This is the Iqvia support and how to get a hold of them. And then if you have general questions for the database, stsdb@sts.org, clinical questions, with helpful links here. I think we took down, yeah. Okay, and then when you go into general thoracic specific, you'll find all of your resources for the version, and 5.21 will be updated with the training manual in the coming weeks. We have about 7 questions left that I'm waiting for clarification on from the surgeons. And Ruth is doing some final review, and then Leanne's going to do some final cleanup, and then it should be posted. And then we'll work on the surgeon worksheets with the core group. So I think that's all I have on that, Leanne. Research Center, this is, you can find current projects and things like that. And if you're interested in doing, if you're interested in getting data from our research center for a specific project, you can reach out to them there. Advocacy, all of our publications, different resources, clinical practice guidelines, expert consensus documents, and then our TSF Foundation, which is our the foundation arm of the society. And then we have up here on the very, very top under patients, there's patient website and patient resources. This is great to share with your care team. I don't know if anybody's ever kind of cruised over here, but we have some very good information that's written at the patient level. If you'd like to share that with your patients, you certainly can. You can just go to the lung cancer one, and but pretty good information. It's reviewed by our surgeons, and hopefully it's good for surgery before, during, and after surgery, what to expect. So lung cancer surgery and congenital surgery, as well as heart surgery. So I think that's all I got.
Okay, thanks, Carol. I think you did a phenomenal job. That was awesome.
Like a cruise ship director.
Right. Yeah, you're amazing. We did have some questions come in. All right, so we have a few minutes left, so let me share my screen. I'm gonna screen one. All right. Okay. Congratulate everyone who's worked on the website and providing all the helpful information for your data managers. Did not have this resource when we started more than 10 years ago. I'll be looking up stuff in the future. Thank you. You're very welcome. Our STS team has done a great job with the website. So they put a lot of work into that. They've done an amazing job. Can you demo the Iqvia site for uploading to show the new checkbox and or new steps in order to upload? I don't know if I don't have access to be able to do that. I don't know if Joe,
Leanne,
if someone
yeah,
from
I
your
have it.
team-
I have it up. I saw that in the,
Okay.
the question come in. I'm ready to
Okay.
demo that.
Yeah, if you want to share,
Sure.
can you, or do I need to stop share?
Let's see. This was nope. It lets me kick you
Okay.
out.
Okay, great.
Share.
There you go.
All right. So all you have to do, the only new step for uploading is at the very tip top here. It says form type and there's this blank box. You just need to choose case form. That's it. That's the only new step. And like I said, when I was speaking with Nancy earlier on the call, it is something we are looking to eventually have default for you. So you don't need to continue to do that. But until we're able to get that update through, all you need to do is choose case form from this dropdown, and you can then proceed with your upload as you always have.
Great.
And
Thank you,
that's
Joe.
it. Yep.
Perfect.
Oh, wait, Joe, before you
All
go,
right.
can
Yep.
you bring back your screen?
Yep.
The very last question, it says, can you please confirm the case inclusion criteria for composite scores specifically as it relates to lung cancer? That information is provided in the national report overview. And I just wanted to show where that was located. If you could open the resource library.
Yeah, sure.
Yep.
Thank you.
And
it's located
this
in the,
first one, right?
yep, very top link.
Yep. Yep. That top link, do you download, click on that analysis overview and download that document. It's a PDF. Yeah, it's a PDF document, and I do have bookmarks in there. So depending upon your browser, you can use the bookmarks. You don't have to scroll through the entire overview. So you can just jump to the lung cancer section, and it'll give you all of the criteria, the inclusion criteria for the lung cancer composite. You'll have the population, the inclusion, exclusion criteria. So all of that information is located here in this analysis overview. So again, that's found in the library of the Iqvia platform.
Thanks, Leanne. That's great.
Thank you. Yep,
Thanks, Joe.
perfect. Thank you, Joe.
No problem.
Appreciate it. All right, let's see. Share screen, screen one, share. All right. Let's see, our next question. Since more data will be collected for minor procedures, will there be any changes to the reporting on the Iqvia website or reports to complement the fact that more data is being collected for those minor procedures? So we do have you can get some information from the unadjusted dashboard for those minor procedures that are submitted. So again, there is some data that is currently available for that you have been submitting. We can definitely look into some type of enhancements if we get down the road and people want more information on those procedures. So that is something that we can look into. So if you have any ideas or things that you may want to see, please feel free to email your suggestions to us. They won't be risk adjusted, but on the unadjusted dashboard, we could provide some additional information. So again, if you could just let us know what you may be interested in seeing, you can email that to me or just send that to Iqvia as an enhancement request. Can you please go over the research again? Nancy wanted to look at, I'm assuming you're looking at the research tab, Nancy, out on the STS website. All that information is out there. If you take a look at it, Nancy, and if you have questions, I think Carol's got it back up. She's got the research center. So we have information on the programs and data access current projects that the research center has done, as well as published research. access and publications for minor requests. All that information can be found there under that research tab. And
I
there's
also,
links there. If you have,
I can explain.
yeah.
Yeah, I can explain these a
Yep.
little bit further, Lena, if you'd like. So the externally funded, that's larger research projects. Maybe you're getting funding from an outside source to provide research. You would have a PI for that. The participant user file, that's something that's probably a little bit newer to STS, maybe within the last five or 6 years, where sites are able to request de-identified data from the STS, and they have to get their project approved. But if they have the proper ability to do the analysis, STS will approve it and will send you the data to do your own research on a specific set of de-identified data. The minor data requests are intended to assist investigators. I believe you get 1 hour, or one request up to 4 hours free, as long as you're an STS database participant or member, I believe. But more information can be found here. Minor data requests are not intended for publication. So this would be things like more internal QI at your hospital. Current projects will provide you information on what projects we have ongoing, who's the PI on that project. It'll give you a list of what the project status legend, what these different words mean. And then published research, things that have come out of the database. This is just amazing, the things that our data is being used for. Industry proposals. This is information just for industry to request a data, to request a data request, or to request data. And then this is all related to industry. And the interactive data tools, this is where you'll find the resource utilization tool that was developed early last year related to the COVID-19 pandemic. And then the prediction instrument are available here underneath the interactive data tools. And this is run off of the PUF file set that our research center has access to. I don't think this is just related to adult cardiac. And again, this is adult cardiac.
Mm-hmm.
So that's the research center. But if you have more questions, you can reach out to our friends in the research center. And I think, did they put their email?
No, they don't. I don't see
Their email.
email.
Hold on.
I think you can.
There's a way to contact us. I just don't know where it's at.
I know. I was looking.
Maybe it's down here at the
for
bottom. Oh, there it is. Contact us. Down here at the bottom is the contact us button. Provide your information, and I think it goes directly to us at STS, and then they, whoever answers these, I think our marketing team answers these, and then they forward them over to whichever department they're specific to. So hopefully that helped, Nancy.
Yeah. Thank you, Carol.
You're welcome.
Your
going to stop
tour has been
sharing.
fabulous. Sure, good.
Yeah, no problem.
All right. And let's see. And that's all that I have for today. We're right at almost at our hour. So again, just mark your calendars. Our next webinar, our next user group call is July 28th, and our next monthly webinar is August 11th. So we'll have some education for you next month on the August monthly webinar. If there's something that you have an idea you would like some education on, please feel free to send your ideas. You can email them to me, ljones@sts.org, and Ruth and I will work on those education topics and get that for you in our next monthly webinar. So thank you everyone for joining me today. Carol, thank you for chiming in and giving a phenomenal tour. Thank you so much. Again, I've been off all week, so I'm kind of trying to get back in the groove and get all my stuff back together again. So thank you everyone, Sydney, Addie, everyone from STS and Iqvia team members for joining. I appreciate it. I hope you all have a great weekend, and we'll see you back here on July 28th. Thanks everyone. Have a great weekend.
Job today, everybody. Yeah, thanks.
Thanks guys.